Greetings, dear hearts. How are you? It's Ms.D here. I'm doing a follow up of right after I had my teeth removed and my dentures, immediate dentures in place. So it's been about an hour since the procedure. My mouth is still numb. My lips, I can barely feel. My nose area, all the way up into my eye, is numb. Uh, I do like the teeth. I do like the smile, but the Novocaine is starting to wear off and I'm starting to feel pain. So I just want to pop on real quick and give a update, uh, a follow up to what happens right after you get the procedure done. So for me, an hour later, what happens is you start feeling all around where the teeth were removed. You can still feel the Novocaine, but you can start feeling a little bit of pain from where the needles went in. My head is feeling like it's getting less pressure. At first when he would pull the teeth, I had a lot of pressure in the front of my head and like the back of my head. Right now that pressure is going. Like I just did this move right here. It feels like I have a itch, but I can't really feel anything. So I'm trying not to scratch hard or not to do anything because I can't feel anything on this side. This tooth, when he was doing the extraction, was harder to come out than the rest. Other than that, I'm feeling pretty good. I feel like I need to lay down a bit and just recover. But it was a big procedure to have that many teeth pulled all at the same time. But I do like my teeth. Oh, one other thing I want to mention. So there's bleeding afterwards. They put the teeth in, and there's some pressure because your gums and everything is swollen up, and the tooth have been pulled out, and the stitches are in. So there's still some bleeding, and so I've been taking a tissue and just kind of gently wiping the teeth and making sure I get the back of my mouth. Can you see that? You can get the blood out of there, and that helps you keep from swallowing so much blood. That's what's going on immediately, but I do want to smile and let you see Miss D's new smile. Not new smile because they did such a good job. This is my actual real smile. They did such a nice job. That looks like my smile that I had without the missing teeth, so I'm really happy about that. Have a little bit more process to go as we get through the process of getting the gums and everything to stop swelling. Make sure the teeth are lined up with the bottom and the bite. Make sure that I get my bottom teeth clean so that they really match. They do come really close right now, but we get my teeth lightened up. Um, I'm just trying to think of the things that I think you would want to hear right after. So going through the process, it wasn't that painful. You know, the needles to numb your mouth, you do have a little pain with that, but not a lot. I don't even want to call it pain. It's like a heavy pricking sensation, but it comes quick and it goes quick, and the numbing happens really fast. So that part was all right. Um, the actual pulling of the teeth, the weaker your natural teeth are, the less pressure that you felt. Um, Most of my teeth, like I had talked about earlier, the dentist had said I had lost so much bone that it was time to just go ahead and pull those remaining that was remaining on the top, that they would eventually come out, and I would have to keep coming in and adding to the partial that I was wearing. They came out pretty easy, but my one tooth, I think on this side right here, it was still rooted in. It took some time. I think it took the most time to get that tooth out than any of the procedure, and he did a lot of work. So I felt the pressure, and I felt, um, just the pulling on that one. But not unbearable, but you could feel it. You could hear a little bit right when they get the connection of pulling the tooth out. You could hear a little crunching like sound in your head, um, which can be kind of daunting. But that was the tooth dislodging. The dentist says lots of times people, once they put the new teeth in, that they have this big lisp. They have a hard time talking. I'm finding that I'm not having that hard of a time. My mouth is still, numb, so I'm not moving my lips quite properly, but the sound is good. I'm really happy with the way I'm sounding. And I think I'm doing pretty well because I wore the partial for so many years, so my mouth is kind of used to having something in it because the dentist said most of the time when he puts the immediate teeth in, people have the lisp and they have this sucking thing that they do, like trying to get used to the plate being in their mouth and they gag. I haven't had any of that, but I think it's just because I'm used to wearing a partial. Other than that, dear hearts, an hour after the procedure, I can say so far so good. I am happy so far with the smile. Um, and that's the main thing, was to fix all the holes in my mouth and be able to deal with the public. So I'll come back a little later on as the Novocaine wears out. The doctor did give me a prescription for some pain med, which I think I'm going to feel it because I can feel a lot of pressure, like pain coming as the Novocaine's wearing off. And he said that should go away within a day or two. Take the pain meds for a day or two, and he said then you probably wouldn't need nothing more than a ibuprofen or something like that if you need that. So I'm gonna follow that because I'm not down for a whole bunch of pain. Other than that, I'm feeling pretty good. I'll check back in as the day wears on. I do recognize that one of the things I'm gonna have to try to deal with is how am I gonna eat. So the dentist was saying, you wanna, today do soups and or something really really soft, but he doesn't want me to take the denture out today, so I don't want to put any food in there and get food caught up in there with, the stitches still in there and everything still new. So I think I will go with soup, and we'll start the process of eating down the road. But right now, I'm going to try to do heal up and avoid infection. I hope this has been helpful. I'm going to keep journaling this process, and I want to say thank you to those who have been going through this process with me all the way since the dog ate my partial, and I've been trying to deal with what am I going to do with my mouth. I appreciate you sticking with. We're now down to look at that smile. Ms.D can smile, and that looks really good. Now we're going to see how we get to the process where it feels natural and not hurting. I want to say thanks for watching, and I hope to see you in the next segment. Bye.